Over the last 25 years, I've had the privilege of interviewing and highlighting some truly interesting people. I mean, everyone who is anyone, both the famous and the infamous, from presidents and their first ladies to kings and queens, movie stars and pop stars, captains of industry, heads of state, sports personalities, innovative entrepreneurs, and some pretty fascinating everyday people. Today, I am extremely proud to introduce you to Dr. Dave Bailey, whose long career in emergency medicine shows his commitment to providing service for the people in his community and for taking care of others. Dr. Bailey, I am so glad that we get a chance to chat today because I can sincerely tell you that first responders are my very favorite people, especially in light of what our country has been going through these last 18 months. And you have actually been an ER physician for the past few years. So let's start out by me just simply asking what drew you to that extremely intense line of work, sir?
So it started when I was little. There was a show Emergency that came around, and it really was the beginning of modern EMS systems and that kind of thing. I really got into it. I was like 6, 7 years old and ran around the neighborhood with my tackle box, had a little phone taped in the bottom of it, and I would take care of imaginary patients and call Rampart on my phone. And always was, very interested in the responder part. When I hit my teens, of course, other things, took precedent, and I really forgot about that piece of my life. And it really wasn't until I got to be 20 that my best friend's father, who was fire chief, sponsored me into getting into the fire department. At the time, I joined because I wanted to be with my friend, and it wasn't until I got exposed to that environment that a lot of those feelings I had as a kid came back, and I truly understood, the kind of work that I would be required to do, and I got, very much into it.
Sir, tell me, how does the field of emergency medicine actually differ from non emergent variety? Because having been a patient, I've had to deal with doctors in both areas.
Right. That's actually an excellent question that most people don't really understand. Emergency medicine looks at an illness, a problem, in a completely opposite way. So if you go to your family doctor and you have like a shortness of breath, he'll listen to your lungs. He'll say, okay, well, you have a history of some trouble with COPD. That's most likely your problem. I'm going to add a medicine. If you go into the emergency room, we look at it from the standpoint of what is what is the biggest problem? What's most likely going to kill you? And we need to make sure those things aren't going on. So if you come in short of breath, we'll say, okay, maybe this is your COPD, and we'll give you some medicine for it, but we're also going to send off tests that are going to look at your heart. We want to know if there's a blood clot in your lung. We want to know if you have pneumonia, all these different things, because we don't want to send you home with a problem that could end up either killing you or having you become permanently ill. I think people get frustrated sometimes because in emergency medicine we don't always find out exactly what the problem is, so we send people home and we tell them to follow up with their primary or their lung doctor or their heart doctor, but and they say, well, what's wrong with me? And we can say, look, it doesn't look like it's it's not something that's going to kill you, but you're going to need some further testing by your primary that we can't do here, or you may need to see a pulmonologist who can do some tests. So that's really the difference. And we'll tell you, come back tomorrow if things get worse. You may have chest pain, normal EKG, normal labs. You come back the next day. Oh, your EKG's changed. Okay, now we know what's going on. So we don't just, throw you out into the wilderness. If things get worse, come back. If things change, because disease doesn't always present itself right away as typical. You may have teeth pain, and we look at you and say, oh, you got a couple of cavities. You come in the next day and you're short of breath with tooth pain. Oh, okay, it's your heart. Now we can say, okay, that's a weird presentation for heart trouble, but that's what it is.
And I actually am a walking, living, breathing example of what you just have described. I'm a heart disease survivor, but it presented itself as a quote heart incident, but not as an emergent. I didn't have a heart attack or something like that. I had experienced some weird chest pains and some shortness of breath and some lightheadedness, and I went in to see. It was painful enough to wake me up one night, and I went into the emergency room, and they found that there was fluid in my pericardium, and that had to be extracted. But that is an outpatient procedure right in the cath lab. But the follow up was for me to, quote, see a cardiologist, just as you have outlined. And I'm just so curious because I know you started your career out as a firefighter. What do you think was the first moment you decided that you wanted to branch out and explore medicine as a career option? Because I pretty much think that firefighters are the bravest people in the world.
So when I started in the fire service, I really liked it. There was this thing called an ambulance. I started writing that as well, and I really, liked the work I was doing on the ambulance. I wanted to become a paramedic, but where I live, at the time, it was very difficult. It's much easier now, but in the early 80s, it was very difficult to get into becoming a paramedic. So I found a 4-year course down at the University of Maryland in emergency services management, and they also trained you to be a paramedic. I started down there, and the University of Maryland has probably like one of the model EMS systems, and they also have shock trauma. And it doesn't take you long once you've been exposed to shock trauma in the Maryland system to catch the shock trauma bug. It's exciting, it's fast-paced, that type of thing. And after my first year at the University of Maryland, I said to myself, I really like EMS, but I want to go farther in emergency services. I want to, start working on, writing protocols. I want to be able to build systems. I want to be able to take care of the patients for longer than the short period of time that they're in the ambulance. And that's when I decided, hey, why don't I go ahead and go to medical school? And when I went there, I still went to University of Maryland, and the snowball just continued to grow.
Mm-hmm.
And that's sort of how I ended up here. I always joke that I am the victim of ongoing continuing education. I just kept taking more classes.
Well, we're all very grateful that you did continue to take more and more classes. But, I shared that I'm a bit of a fangirl when it comes to firefighters just because of the work that they do. And I'm just fascinated at the level of stress that can be brought on and their ability to keep a cool head. So I would love if you don't mind sharing some examples of stressful situations where a cool head actually allowed you to achieve success in the face of what might be difficult odds for anybody else.
And actually staying calm and having a cool head is one of the most important things. When you're no longer able to stay calm and think, you start making very bad decisions. You make decisions for the wrong reasons. We had a fire once it was a row of shops. The guy decided he didn't want his business anymore and he was going to burn it down. So the crew and we entered, and shortly after entering, the roof collapsed. And we had to go in. There were 3 guys that were, almost to the kitchen where it collapsed. We had to go in, and you have to have a cool enough head when you go in to be able to search. You can't be preoccupied with what's that noise, man, it's hot in here, or you have to be able to, to think, to find them. And then in this case, they had to be cut out of a bunch of wires that fell out of the ceiling, so we couldn't just, grab them and run. I always say that calmness is almost courage and repose. It's that ability in the face of fear and to stand there and make good decisions. And it's the same in emergency medicine.
And Dr. Bailey, I understand you have a little bit of a nickname at the emergency room. What do they call you?
They call me the battleship because I move slow, but when I get there, I'll fix the problem.
That's what we want. As patients, that's it. I don't care how slow you are. If you can fix the problem, that means that you provided the service, and that's all the patient wants from a medical
when you
professional.
walk into the room, the patient sees you're calm.
Mm-hmm.
If I go blowing into a room, the patient's like, oh, what's wrong? The doctor's, tearing into the room. If I just walk in, hey, I'm Dr. Bailey. What's going on today? their stress level goes down, their anxiety level goes down. And it makes it so much easier to work with them, to talk with them, that kind of thing.
If I don't see panic in your eyes, I'm already feeling a lot better. Trust me on that one. Having been on that bed numerous times. Looking at your resume, obviously, I get the impression that service to others is very important to you. So I have to ask, Dr. Bailey, how do you give back to others outside of your work with the emergency room and, of course, your beloved fire department?
A lot of the ways that I serve the community is still through the fire department. Um, my father was, also very big in the church. Sometimes we'll, go on Fridays and, uh, serve food. They have a kitchen that opens up on Friday at Kingswood, or we'll go help at the empowerment center at the church we're at. Just small things that help them either find a job, or a lot of times they can't get the medication that their doctors have ordered for them, and the ability to, what do they have to do to say get Medicaid, and to apply for that, or so a lot of times just being able to provide them with an understanding, this is what you need to do to get these things done, or getting a nice new set of clothes. We have a clothes closet they can go to and try different things on, and that, so they're not walking around in.
Mm-hmm.
The church will even, if you need it, they'll even, like, if your clothes are really wet and, soiled, they'll wash them, you'll put them in a washer, that kind of thing. So just being able to, help people feel better, because
Mm-hmm.
the homeless people aren't, they aren't just the ones that you're seeing out there that you think, oh, I can't, I can't go near him. A lot of those people used to be functioning people. They used to have jobs, they had families, or they still have families, and something has happened to them that's knocked them off the rails, and this is where they end up now. And I always looked at it and said, there, but for the grace of God go I, because it can happen to any one of us. If the catastrophe is big enough, we can all find ourselves without a home.
Right. Compassion and empathy is absolutely imperative in our communities today. And I appreciate that you and your family participate in church activities, which is really, the mainstay of most communities, where giving back to others is just a part of the DNA. I know that you have what I call your work family, and you also have your at-home family. So let's just compare and contrast, because you are one lucky guy to have both. What role do you think each one of these families has played in helping you succeed personally and professionally?
So my father, who's always sort of been, or was my moral compass, um, we would have long talks about everything from morality to religion to, and he had no end to his thoughts, but he was a very strong moral individual. And even when I was a teenager working towards Eagle Scout, he was a big participant in my project, which was, in fact, he came up with, he's like, let's go to a church in Wilmington, Delaware, find, a bunch of, 10 homes that really need, some help for the winter so that the people aren't cold. And we went in, we worked with the windows, the doors, the walls, things that made it so that the house was relatively airtight, so that when the wind blew, it wasn't, going through the house like a hurricane type of thing.
Of course, you were a Boy Scout, sir.
I also, during that time, worked with my church. I got what's called God and Country. It's a religious service award as well.
Mhm.
And I really enjoyed that. The minister that I worked with on that he was so fantastic. Such a nice guy. And that, again, it had a lot of stuff to do with service. And I would go up on Saturdays, especially around Christmas and Thanksgiving, and he would have these boxes set up that I would load up, and he would give me addresses to drop them off to, and that type of thing. But it also had a lot to do with Bible verses, speaking at church about service, speaking at church about helping others, sort of a you're your brother's keeper type of thing.
So, Dr. Bailey, as we conclude, I'd love to know, what is the one thing you'd like the viewer of this video feature to walk away with, sir?
And especially through the past 2 years, COVID has really taken the system. It's beyond stressed. It's, to some extent, it's sort of broken it almost. It's showed us where the fractures are. But I want people to know that there is a safety net out there, and that safety net is made up of people. Those people who have decided to put, others first, whether they're nurses, firefighters, paramedics, doctors. They came to work, they put themselves second, they put their family second so that they could come to work. And I really want the public to know that, we need the public support. Not necessarily in money, but in, when you go to the emergency room, don't rip into your nurse, don't be nasty. Or same with the EMS people that come in. There's already cities that are closing professional firehouses because they don't have the manpower. So an engine that used to be 2 blocks away when your house caught on fire and your kids were trapped is now 1.5 miles away, because you couldn't, they couldn't keep it open. Same with ambulances, same with paramedics. You have to get to somebody whose heart stops in 6 minutes. But, if you can't afford the paramedics, or if there's nobody there to get in the truck, those distances increase. And same with nurses. We're closing rooms in the emergency room or your nurse is covering twice the number of people that she should because people aren't becoming emergency room nurses anymore. And we need to support those people. We need to hold them up. We need to say, these are the people I want to be like. These are the true, but instead of saying when I grow up, I want to do, I want to be in movies or be a rock star, say, I want to be an emergency room nurse, or I want to be a paramedic, or I want to be a firefighter. Hold those people up and say, these are the ones that, we want. These are the ones that still have the values that we so prize in our country of commitment and duty and compassion and courage.
They are the ones that are truly the rock stars, if you think about it. And we all depend on you all and your colleagues. We certainly do. I told you when we first started, I'm a bit of a fangirl when it comes to firefighters. I believe wholeheartedly this quote that I read years ago, that bravery is not the absence of fear, but action in the face of fear. And that is truly what firefighters, they live by every single day. And I am just grateful that we have you all and our first responders, and just quite frankly, all first responders do noble work, and all of them deserve our respect and appreciation. I'm just so happy that we've had this opportunity to share this conversation where I get to say personally, thank you on behalf of a grateful community. Thank you, Dr. Bailey.
And thank you so much for having me. It's been an honor.